Good morning, everybody. Thanks for being here. I wanted to start by just talking a little bit more about people to thank. So Lisa being the number one person to thank. You know, we've been working with the town of Holliston now for close to a year on this project, and there's been lots of pieces and parts to it, and it really would not have been possible without support from the town, obviously, but Lisa and her staff who've been sort of our shepherds along the way, and the Council on Aging in particular. And then also just want to take the opportunity to thank all of the residents of Holliston who completed a survey, who participated in a focus group, the municipal leaders who were willing to give of their time to be interviewed. What I'm about to share with you is the results of something that is really speaks to the participation. You know, the outputs are really as good as the inputs, and we had really great participation here in Holliston. So I wanted to just make sure to thank everybody for their contributions to it, as well as to remind everyone sort of the purpose of the project, which was to conduct a study really looking at the needs and the interests of older adults living in Holliston, thinking about their needs now, but also looking out to the future. The purpose, the final report, is intended to sort of inform planning, and that's here at the Senior Center, so planning around programming, services, capacity, things like that. But also we included a number of, we know aging in community does not only happen at the Senior Center, it happens in our community, and so there's also, I think, a lot of information here that will be informative to other municipal departments as they think about planning, and also to raise just general awareness about the issues related to aging in community across the town more broadly. So a reminder as to what we did for the project. We started with some key informant interviews where we sat down one-on-one with people who had particular vantage points on the community. So you can think about chiefs of police and fire, the town, a sort of board of the select board, as well as other sort of the planner and folks who can speak to the town more broadly and the priorities that are facing the community. We also conducted a series of 4 focus groups. So those were more in-depth sort of group conversations. They were targeted towards residents who are both currently aging in Holliston, as well as people who are anticipating aging in Holliston in the future. Also included municipal staff, people who work sort of frontline directly with residents of the community, and also what I call sort of community stakeholders. One of the limitations of our work is that we hear from people who are willing to be heard from, right? So we know that there are people in the community who, for whatever reason, don't complete a survey, don't participate here at the Senior Center, but have important experiences for us to learn about. So we tried to engage folks who may have an insight into how their experiences are going in Holliston. So you can think about faith community leaders, real estate agents, home health agencies, veteran services, sort of people who have sort of the eyes and the ears on those segments of the community. And then lastly, sort of the main event was this survey that we conducted of residents age 55 and older in Holliston. We received 1,322 responses to that survey, which is a response rate of about 26%. So we mailed it out to everybody, 55 plus, and we heard back from about 1,300 of those folks. And so that's the information that we're going to be sharing. That's really great. That's a great, strong response rate. And so I think that speaks to people's interest in being heard related to this topic. So starting with just sort of some demographic characteristics, sort of understanding the age distribution in your community. Currently, based on estimates from the American Community Survey as of 2021, about 24%, or about a quarter of Holliston's population, is age 60 or older. And we anticipate that will continue to grow, that portion of the population. So this slide shows you looking back to the year 2010, so the decennial census that we had in 2010. It includes American Community Survey estimates from 2020 because we don't yet have the age-separated 2020 decennial census. And then here in 2030, we have some projections that are prepared by the UMass Donahue Institute to look at sort of how it's expected or anticipated that the community will be shifting in 2030. And so over this period, you can see that and I have this sort of total population above, you have sort of a slight decline in the total population of Holliston, but what you see is that the people in this this 50 plus, and especially the 60 plus, those bars are widening. And so the idea is that although your population overall is relatively stable, maybe declining a little bit, you're seeing that the proportion of older people is getting larger. So that demographic sort of shift is part of the rationale as to why we're wanting to take a closer look at what it means to age in community for this segment of Holliston's population. And so I'm going to present some of those sort of key findings. I will say that anybody who remembers the survey remembers that it was long and that there's lots of information. And what I'm going to hit on today is really just sort of the highlights of the results. And so this isn't everything. But we first asked people about how important it is for them to stay in Holliston as they age. And what I'm showing here and what I'll show in most of the slides is the results by age group. So we have folks in their 50s separated from folks in their 60s, their 70s, and in their 80s. And so you can sort of see how responses changed based on the age group. And the blue bars, the blue sections of the bars, both the dark blue and the light blue, indicate that it is either very important, so the dark blue is very important, and the light blue is somewhat important for them to stay here in the community. And this top piece, the sort of beige and the orange, are for respondents that said it was only slightly important or not at all important for them to stay in the community. So what you can see is for the folks in their 50s, you actually have a relatively sizable share of folks in their 50s who say it's only slightly or not at all important for them to stay. So it's about 40% of people in their 50s who sort of are not, but that shrinks over time. So as people reach old age in Holliston, they're more likely to want to stay here. And so you can see that, for folks in their 60s, about 26% say it's only a little bit important for them to stay, and that declines all the way up until in the 80s, you only have about 9% of those folks who say it's not that important for me to stay. So as people get older, it's important for them to stay in the community. We also asked, given that you want to stay in the community, what are some of the things that concern you about being able to do that? And this was an open-ended question, and people were able to write in whatever came to their mind. And we heard from a lot, I think it was like 92% of survey respondents took the time to write something in. So we went through all of them, we put them in categories, and we pulled out some sort of quotes, which is what you see here. So the number one, not surprising probably, the number one concern people have about being able to stay in Holliston is the cost of living and the affordability of the community. And so you can see a quote related to that directly from a resident who talks about the town costs sort of outpacing or outstripping their pension. So costs are rising, income is not, and that becoming really presenting this decision about whether they can stay or leave the community. The second sort of most commonly reported concern is related to transportation options and this sort of more broadly overall sense of being able to access the community. So people were really talking about both transportation, but also sidewalks, also sort of physical ability to get out and to access the community. And there was also a lot of sort of future concern about transportation. So not a lot of people saying right now, this is my concern, but a lot of people talking about, for example, if I can no longer drive, if support is gone, I will have problems getting food. So it's not just about sort of the current need, but it's also this anticipated need that this is a community where if you don't drive or you don't have support to sort of help you access the community when you need it, you're really stuck. And then the third is related to sort of maintaining property and finding downsizable options. So sort of related to housing, and it was more specific about people being concerned about being able to maintain their current properties and their current homes, and also about if they needed to move from their home, there isn't really a downsizable option that's here in the community. And so one of the folks, writes about stairs in my home limiting their ability to leave as often as they would like. And so again, it's that sort of connection between physical environment at home influencing sort of their sort of ability to get out and access the things that they need to get access to and also sort of socialize. We asked folks specifically about some of these issues related to home modifications and that sort of built environment. So we asked about whether the people's residence currently has a bathroom and a bedroom on the entry level, and that's sort of an indicator of being able to stay, age in a home. And what you see is about 42% of survey respondents say no, they do not have that set up currently at home. And so that's an indication sort of the housing stock here in the community, and also a potential flag for thinking about how folks in those kinds of homes are going to be able to age there safely. We also asked more specifically about whether your home needs a home modification, and so that's like a ramp, grab bars and showers. So it's not repairing something that's broken, it's adding something to it to sort of make it more livable. 41% of respondents said yes, they need something like that in order to stay in their home safely, but only about 10% of those folks who said, yes, I need these modifications, say that they cannot afford to make them. So there's 41% who say, yes, I need to do something to my home. But there's among that 41%, a number of people say, yes, I can afford to do this, I just haven't done it. But there is this segment of the 10% who say they need something done at home, but they can't afford to do it. And then similarly, we asked specifically about home repairs, so needing to fix something like a roof or a heating system or new windows, something to sort of fix up the home to make it safe. And similar portion, 38% say, yes, I need something like that done, and 11% of those who need it say they cannot afford it. So among people who need to make modifications or repairs, it appears that there is a relatively big portion of people who need to do something, but there's a smaller segment that can't afford it. So it's sort of both about, what's preventing people or keeping people from making those changes who can't afford it, and then also thinking about how can we support people who cannot afford to make these changes to their immediate environment. We asked people about their preference for future housing. So we make the assumption that no one wants to leave their current home. And so we had to we framed the question as if you had to, if a change in yours or someone in your family's sort of health status required you to move from your home, what kind of housing would you prefer? And again, this is broken down by age. You can see that folks in their 50s would most prefer a smaller single-family home. And then when it gets to folks 60 plus, the preferences actually were relatively similar across people in their 60s, 70s, and 80s, being that their most preferred type of housing is actually a 55 plus community or an assisted living community. So really sort of an eye towards housing that's relatively supportive or has the ability to provide services within that housing is something that people are looking for. We asked about current driving status, so not just do you drive or don't you drive, but we actually also asked, do you limit your driving in some way? So maybe you avoid driving at night, you don't go in unfamiliar areas, you avoid highways, that kind of thing. And about a quarter of survey respondents say either they don't drive at all or they do limit their driving in some way. So that's a quarter of people who are already thinking about sort of how to keep themselves safe when it comes to driving. And we asked about why, or sort of what the challenges are. So people who don't drive or who modify their driving, what are some of the challenges that they face in terms of getting transportation? And the number one issue was the unavailability or inconvenience of the transportation options that are available in Holliston. So there are a few. There's not a lot, but there are a few, but people are really talking about the fact that those are inconvenient systems or unavailable to meet their sort of preferences and needs is a big challenge for people who don't drive. And then we asked, these are some quotes specifically about transportation that people were concerned about relative to getting transportation that they need. So specifically not available to some places and on certain days. People are really talking about relying on relatives for medical trips specifically, and how that can be burdensome. And then, this person recounting their mother needing help to get on and off the bus, and there really wasn't a transportation service that was supportive of her needing help to get on and to get off the transportation. So within that, there's some specific challenges. We also, one of the other sort of big takeaways or sort of striking findings for us was that 38% of the survey respondents said that they are caregivers, so they're providing care to someone who is frail or disabled. And among them, 64% say that caregiving, the ability to provide that care and meet their daily responsibilities, 64% say that's very challenging for them to do. So this idea that there's 38% who are providing care, and among those caregivers, more than almost 2/3 of them are really saying this is hard for me to manage my life. We asked about what are the reasons for needing care. The biggest one was general frailty or difficulty sort of ambulating, getting around. But then secondly was a chronic disease related, cancer, diabetes, asthma. And then the third being Alzheimer's or dementia. So 27% of people are caring for somebody who's living with the dementia. So this is just sort of one of those, it might not always come top of mind when we think about what do seniors need or what do people aging need. And I think a lot of times it's because these folks are deeply busy and deeply embedded in things that are happening in their own lives, and that might prevent them from participating here. Certainly adds a lot of stress to their existing situation, and I think is an important sort of need to be thinking about. We asked a bit about sort of communication in terms of how people get information about what's happening in the community and what their preferences are for that. 37% of the 1,300 people said that they do not know who to contact if they or someone in their family needs help accessing services. And so there's that's what's shown here. So this idea that, that's a significant share of people who simply, if they needed something, wouldn't know where to start looking for help. And when we asked about specific sources of information, the Senior Center newsletter is for folks in their above age 60. That was their number one sort of preferred way of getting information about what's happening. So, kudos to the newsletter, and also thinking about if that's a really great source of information, how do we amplify it? How do we sort of make sure that everybody knows what's going on there? And then for folks in their 50s, they talk about the town of Holliston's website as being their most preferred way of getting information. And then we also have HCAT coming in third, or fourth, and community news. So there is a variety, I think that's the other piece of this, is that there is some preferences, but overall, I think in this day and age, people want sort of to hear about it from multiple avenues. The other striking thing that we wanted to comment on before we dig into the Senior Center specific questions is this idea of retirement. So we did survey people 55 plus, and many of them are still working. And we understand that working prevents a lot of people from being able to participate here, and also just in general makes them have sort of a different relationship with the community. So we asked people, when do they think they're going to retire? And 45% of people who are still working expect to retire in the next 5 years. So we took the people who say, yes, I'm still working, and we asked them when they think they're going to retire, and 45% within the next 5 years. So that's significant in terms of thinking about people who are going to suddenly potentially have a lot more time and be sort of around in the community. And so when we think about sort of demand on services and programs here, that's something I think to keep in mind. And also the other piece I wanted to just sort of point out is that sort of in combination, there are 27% of the survey of the folks who are still working who say that it's unlikely that they'll ever retire, or that they don't know when they will ever retire. And I think that's another important segment to think about. We know a lot of people are staying in the workforce because they have to, because the cost of living is so high and continuing to rise, and also because they want to. But this idea that there's going to be this segment that is continuing to work, and to think about how do they have access to the things in the community, and what kinds of things are they looking for. Okay, so the next sort of section of results is really specifically related here at the Council on Aging, and then I'll touch on just sort of some thoughts about where to go from here, and I look forward to your questions as well. So we asked survey respondents if they have ever been to the Holliston Senior Center. And what you see here is people who said yes to that question. So this is people who have participated here by age. So you can see down in the 50s, you had about 10% of people in their 50s said, yes, I've been to the Senior Center. And what you see is a pretty steady decline, or incline, all the way up until folks in their 80s, more than 60% of them participate here at the Senior Center. So this is not an uncommon trend that we see, in terms of who's participating. But I think what's important to know, that you're currently, serving a significant share of folks in their 70s and 80s. And so it's trending towards sort of the older segment of the population. And when we asked, so among people who say, yes, I've ever been there, we asked them, how frequently do you go to the Senior Center? And 59% of people who've ever been here only come once a year or for a special event. So among users, more than half of them only come about once a year. So just to kind of help us understand sort of who's using the senior center and what's their sort of relationship with it, I think it's important to note that, yes, you're serving, a lot of people said that they come to the senior center, but that, 59% only come once a year for a special event. We asked for people we asked this for everybody. We asked what would get you, or why don't you come to the senior center more often? And the number one reason that people said that they don't come here more often is because they're not interested in coming for a variety of reasons. There are also, a lot of people wrote in other, which I'll talk about in just a second. And then you can see that I'm not old enough or I don't have time as being sort of the third most commonly reported reason for not coming. So we wanted to dig into that other category and sort of see, well, what's this other reason that people aren't coming? And so we looked specifically at those those responses, and what we sort of found is that there's this idea that you have to have a need to come to the senior center. So people are really talking about, I don't need the center. I'm still healthy, I'm still active, I just don't need to go. And so there's a number of quotes here, so no need for the senior center at this time. People talking about other people need it more than I do. I'm still, independent physically, and I don't have any health problems, financial problems, or transportation problems, therefore I don't need to go. And then the other is just sort of an elaboration on this topic of not having time. So a lot of people telling us why they don't come is because they have all these things going on. And so I think it's important to note the piece about not needing the senior center as this kind of like, that's what people sort of connect the senior center with. You need to have a need to come to the senior center, not just because you want to or because something is of interest to you. So that's a bit of a perception problem, I think, that we can work on. And then thinking about not having enough time, just perhaps another sort of further consideration of the number of things, including caregiving, not just for someone who's frail, but also for children, and working as being sort of barriers to participation here at the center. We asked what would get you to come? What would increase the likelihood of you coming to the senior center? We gave them a number of options, including the ability to tell us in their own words. And what you see here in the dark blue are people who are users of the senior center versus people who've never been here. So we're comparing these responses. And so among people who are current users of the senior center, the number one thing that would get them to come or make them more likely to come is an other response, where they like to tell us in their own words, which I'll summarize for you in a moment. But among people who are non-users, so people who've never come to the senior center, the reason that would get them to come, the number one is if programs were better suited to my interests. And secondly, if there were more people like myself at senior center events, which was actually number two for both users and non-users. And so this idea of seeing yourself, or sort of self-identifying with what goes on at the senior center, seems to be a really compelling avenue for thinking about how do we sort of change our image or change how people see us and understand what it is that we do here at the senior center. This other category. So I didn't include that slide here, but the others, people who wrote in, the thing that would get them more likely to participate is the triggering of some kind of need. So going back to that previous slide about people saying, I don't need the senior center, so I don't go because I have everything I need, I don't need to go. And so when we asked what would get you to come, people said, if I needed something, if my health changed, if I lost my ability to drive, if my spouse passed away, if I lost all my money, that's what would get them to come, is if something in their life prompted this need. So again, going back to sort of the triggering of only coming here if they need something, that was sort of what people were writing in related to getting them to come more frequently. We also asked what people want to do or what they'd like to see more of happening here at the Senior Center as far as programming. And I split this out again by people who use the Senior Center currently and people who've never been to the Senior Center, understanding what would they like to do more of. Among people who currently use the Senior Center, I'm showing you just sort of the top 6 options. There were a number of options, but these are sort of the top 6. Day trips, indoor exercise, and performances and presentations, seeing more of that is what people who currently use the Senior Center would like to see more of. Among people who are non-users or who have never been here, access to outdoor exercise, technology skills classes, and educational programs were among the sort of top things that they would like to see more of. So when we're thinking about how can we attract people with what kind of interests, people who've never been here, this is what they would like to see more of. So just to touch on some very basic recommendations, I'm not going to spend a lot of time reading these slides to you, but we can certainly have a conversation about them. You know, this idea that you've got the segment of your population that's older is growing, that group is getting larger, and also sort of coupled with sort of the anticipation of retirement and having particularly, more time on their hands, these kinds of things point to potential expected growth in demand for senior centers and programs and services, or at least an opportunity to sort of engage residents. So thinking about both the capacity, the physical capacity, and the staffing capacity in terms of being able to meet the needs and range of ages and interests of the older adult population will be an important sort of thing to think about. Sort of how, if we have this larger group of people who have these different kinds of interests and needs, and we want to meet them where they are, how do we get there? And that's going to require some sort of internal thinking about sort of physical space and also staffing. And that this preference towards physical activity and lifelong learning kind of contributes to that. So if we want to have this robust set of programs related to lifelong learning and having all the technology so that people can come and join remotely and speakers can Zoom in and all of this other stuff, sort of thinking about how do we accommodate that, as well as sort of this increased preference for physical activity as far as having like space for large exercise classes or having exercise equipment available for people. All of that is sort of related to reflecting on what are our resources now and how can we think about expanding them or leveraging them moving forward. Also to address the sort of perception that the COA is needs-based, I think is an important thing to think about. How do we do that? We can think about rebranding, changing the name, coming up with an image that sort of reframes aging as a positive thing, and that aging in Holliston is something to be proud of. And also this relates to a broader conversation about sort of joining in on some of the age and dementia-friendly stuff that's happening around the state. So communities are really sort of formally signaling to their communities that we want to create more age and more supportive environments for people to age, and that offers an opportunity to sort of talk about what does it mean to age in our community. Also sort of welcoming newcomers here in terms of having some kind of incentive for bringing in a friend or hosting programs that are targeted specifically for people who've never been here, because sometimes it can be intimidating to come to a place where you've never been. And then thinking about the programming that doesn't necessarily align with people wanting things that's more interesting to them, and how do we do that? There's some examples of some different programs that could be considered in terms of like an outdoor activity club, pilot testing, lifelong learning programs, specifically trying to identify what residents have to share. Whether they have a skill or an experience that they'd be willing to sort of teach others or sort of share their experience, and kind of tapping into current residents as an option. And then intergenerational programs for folks who are interested in that kind of thing, reverse mentorship or connecting students with older residents. And I know some of that is already happening, but kind of continuing along that vein is something that people are interested in. And then the housing piece, trying to connect people with contractors or handy persons who can help with those modifications or repairs, and having a way of getting that information that's through a trusted source. And then thinking about, kind of continuing to be part of the conversation around housing. I know obviously the senior center isn't in charge of developing housing, but to contribute to that conversation that, especially around assisted living or senior independent living, that's something that seniors want. And so kind of helping to participate in those community discussions. And then promoting awareness of property tax relief programs, and maybe even thinking about expanding the eligibility of some of those things so that more people can take advantage of them. So we do have some of these things already sort of in the, they exist in the community, but really thinking about how do we get more people to know about that, and how do we get more people to be eligible for those kinds of programs. And then transportation, thinking specifically about folks who are non-drivers or who have mobility limitations, and really trying to target them to make sure that they know what the transportation options are, and even maybe having some kind of travel training program where you actually help people sort of walk through the process of how do I arrange for the transportation, all the way to how do I get on the bus, do I tip the driver, all of those sort of questions that sometimes can prohibit somebody from doing it because they're afraid. And then also sort of volunteer transportation programs. There are some examples. One is called Friends in Service Helping, which is a fish that's in some communities. And then also there's this concept of developing a village in the community. So this is a model where residents can actually come together and form a village in their community where it's sort of a peer-to-peer helping network. So it actually started in Boston. Now they're all over the world. It's based on a payment model where people sort of put in X amount of dollars per year to be a member of this village, and then they use those monies to do programming and to also sort of pay for somebody's groceries if they just came home from the hospital, or help get arranged for a taxi service to Boston if they need medical care, or pay for a caregiver to come in and help them do some work around the house. So it's this idea of it's all sort of peer resident led, and there are lots of different versions of it, but that's something, transportation can be a big part of that in terms of giving people rides, and it also often takes away some of the feeling like people don't want to burden their families with, I need a ride, I'd really like to go get my hair done, but that's not a necessity, so I'm not going to ask for a ride, or something like that, where they might feel more comfortable asking a friend or a peer to give them a ride. And so it can be really a powerful model for that. And then the caregiver piece related to sort of how do we get caregivers information about what is available to them as far as like a caregiver resource fair. There's this Dementia Friends training that's available that could be done for staff, not just at the senior center, but maybe more widely in the town, that helps raise awareness and sort of give some tips and tricks as to how to communicate with someone who's living with cognitive change. And then respite is something that's always needed. There's sort of the adult day health model where there's like adult day programs where people can drop their loved one off and sort of go to work, that kind of thing. Those don't exist as much as they used to. So thinking about other ways, so there's some volunteer respite programs that are popping up. So again, it's not a whole day, it's just a couple of hours. Someone can come and spend some time with a volunteer while their caregiver goes get some errands done or something like that. And then also providing transportation to other adult day programs in the area as being some ideas. So again, these are just some ideas. They're certainly not prescriptive in any way. It's the intention for this work moving forward is that we have all this information, we have some ideas for where to start with that information that we're turning over to Lisa, to her board, to the town, and the idea is that this work will guide some discussions about how to continue to improve the Holliston as a community to age. So with that, I will thank you for listening.